Welcome back. I'm Dr. Mona, a board-certified pediatrician and mom of two, and this video is part 2, guiding you through infant spit-up and GERD. If you didn't watch part 1, where we went over symptoms and red flags and why it happens, make sure to do that first. If you already did, let's get into management strategies and how I approach reflux in infants, including if a chiropractor is guaranteed to fix all your baby's reflux problems. Now let's dive right into how to manage spit-up and reflux. Management can include non-medicated and medicated options. I asked my followers what helped their babies with reflux, and here is what they said. The most common response was time, as they age out of this. Another common one was meds, and so I want to first say that I personally always discuss other modifications before meds, but I also know that meds can really help, especially if there's a concern of irritability due to acid production that we can sometimes see in GERD. Let's discuss non-medicated options or lifestyle modifications. It's important to note that for happy spitters, you don't have to do anything as they're gaining weight well and growing well. If it's a little spit up, they're not really bothered by it, and they're thriving, you can carry on as you normally are. But you may consider some of these tips to be helpful to reduce the symptoms if you feel it's needed. The following modifications are highly recommended in GERD and can also help in happy spitters too. Consider feeding techniques like paced bottle feeding or sideline feeding. If the baby is chugging their milk at the bottle within a few minutes, they're more at risk for that milk coming right back up. Paced bottle feeding allows for more control in the feeding process that can limit spit up. Sideline feeding can also help, especially when baby is placed on their left side, as it increases the space from the bottom of the stomach to the esophagus, making spit up less likely. Check out my bottle feeding basics video for more on how to do these techniques. Watch air intake. If they seem to be gulping feeds down, you will need to burp them. Also watch their latch on the nipple and for things like tongue tie that can make the latch worse or more painful if you're nursing. If bottle feeding, consider trialing various bottles such as anti-colic bottles and confirming that you're not going up too fast or staying on a nipple size that is too slow for them. Also, like I mentioned, confirming that there's not a tongue tie. A tongue tie can impact the feeding and latch both on the bottle and the nipple, so it's good to make sure that we assess this. And if you're not sure, you may need guidance from a lactation consultant or newborn feeding specialist on how to best manage feeding at the bottle or breast. Consider smaller, frequent feedings. It may take a little trial and error to find the right volume and timing for your infant, but their bellies are small, so the more volume you give, the higher the risk they are spitting it back up. And this amount can vary baby to baby. Burp in the middle of feeds or after. Now, I don't want you to panic burp your child out of stress, but try to get the burp out. Extra gas in the belly can bring up more milk and also cause more upset tummies. Here are some ways to burp your baby. Keeping them upright for about 20 minutes to 40 minutes after feeds. Now this can feel hard, but the reason this can help is that it allows gravity to work in your favor to keep the milk down. If your baby is up every 2 to 3 hours, this may start to feel like so much for you. So if you get tired, be sure to lay them flat on their back so you can sleep and utilize any help to get you through this. During the day, keep them upright. You can try wearing them in a carrier, walking around, holding them, or letting them lay on you while you're awake after they feed. In regards to playtime augmentation, many times parents of babies with reflux will avoid floor time because of the spit up and the mess. But we know floor time is so important for all babies to develop gross motor skills. With tummy time, they may spit up, so be sure to place a burp cloth in front of them for any spit up. You can also alleviate pressure in the belly by performing tummy time over your leg. And if they're uncomfortable on their back, try sideline play, which provides floor time but more comfort than laying flat on their back. For sleep time, if swaddling a baby, make sure that the swaddle isn't so tight at the stomach, causing it to compress the belly and lead to more spit up. You may want to loosen up that area if you find that it's worse with the swaddle on. In terms of allowing baby to sleep on an incline, this is a decision made between you and your pediatrician. From a safe sleep standpoint, it's not considered a flat surface to be on an incline, but I do know that we discuss case-by-case basis with families to weigh benefits and risks. Do remember, however, that a baby lying flat on their back that spits up will not choke on their milk. See this video for a demo of why this happens. If formula feeding or pumping milk, considering thickening the milk. If reflux is still noted, it may also be worth discussing a trial of thickened feeds with your child's clinician. This is usually done by adding oatmeal or rice cereal to formula or express breast milk, which thickens the liquid, making it less likely to be spit up. Think that the milk is heavier and thicker, so it's less likely to come up because gravity is helping keeping it down. For nursing mothers, the potential moderate benefit may not be worth the inconvenience of having to exclusively pump if that's not something that you're doing. So in this situation, you're gonna do what works best for you by discussing it with your child's clinician. For formula-fed babies, there are some pre-mixed thickened formulas available, such as Enfamil AR and Similac for Spit Up. Be sure to talk with your child's clinician before switching formulas so you're not switching unnecessarily. Considering switching to a specialized formula. Sometimes we may recommend switching formulas either to one with probiotics or thicker formulas like mentioned already. If a clinician is worried about a milk protein allergy, which is reflux in a baby who is colicky, who has eczema, and/or who has blood in the stool, they may recommend removing dairy and soy from a breastfed baby's diet or switching to a hydrolyzed formula that does not contain milk protein. More to come on future videos here discussing cow's milk protein allergy and also separate video on formula education. Probiotics. Similar to colic, studies of probiotics containing L-reuteri saw that probiotics can decrease spit-ups and colic episodes in babies. From a clinical standpoint, I do see occasional improvement of symptoms when a baby is on a probiotic, but there is not enough research to make a blanket statement. BioGaia and Gerber Soothe are two probiotics that are available over the counter that contain L-reuteri. If you want more info on probiotics and where the evidence of their efficacy currently stands, check out this YouTube video for more information. I do recommend speaking to a clinician before starting any probiotic, especially if your baby is premature or immunocompromised. What about medications for reflux? Now, if we've tried everything, which is lifestyle modifications, consider the need to change formula, thicken the feeds, diet modifications if we need that for the mother. Then I consider medications. I'm not against meds, but the way I practice, it's the last thing I consider after trying everything else that makes sense for the baby. The meds used are typically PPIs or proton pump inhibitors, and they work by blocking gastric acid production that can lead to that uncomfortable feeling with the reflux in some babies with GERD. Medications may not eliminate the spit up altogether, because remember, that can be a very common physiological thing, but it can make them more comfortable due to acid reduction. Reflux medications come with their benefits and risks, and so it's best to discuss the use with the clinician. Now let's talk about how I approach spit up reflux GERD. When I have a patient come into my office with this concern, the first thing I look at is weight gain, and the most important things I ask are, how is feeding going at the breast or bottle? And is the baby bothered by the spit up? Is the child fighting feeds? Are they uncomfortable? Do they latch well on the breast or the bottle? Feeding mechanics are important. Comfort is important, and weight gain is also important. Another important thing to note is if there is blood in the stool, or moderate to severe eczema and reflux, as this can be a sign of a milk protein allergy. On exam, I'm looking for a tongue tie, torticollis, which is that thickening of the muscle in the neck, hypertonia, which is very high tone or stiff body, or hypotonia, where the body feels floppy, all things that can increase the risk of reflux or GERD. If feeding is going well, there are no concerns for a milk protein allergy, no tongue tie, physical mechanics besides the gut, everything looks great. I like to discuss non-medicated options and lifestyle modifications. Based on this thorough assessment, a plan is made that may include one of many of these things that I've discussed. For all babies, I discussed the lifestyle modifications, but here they are again. If a child has torticollis, I recommend physical therapy to help. If a child has a tongue tie that's impacting latch, causing pain for the mom when they're nursing, or causing issues with feeding, leading to unmanageable reflux, I do recommend a release. If a child has feeding issues with the latch or at the bottle, I try to help them or refer them to a newborn feeding specialist or an in-home IBCLC or lactation professional that can work closely with them. If a child is having poor feeding at the bottle despite trialing various techniques and bottles, I recommend a newborn feeding therapist. If a child is on formula or pumped breast milk and we've tried all lifestyle modifications, then I discuss thickening feeds, probiotics, or potential switches of formula to ones with probiotics in them or thickened formulas. For me, these decisions are nuanced and a case-by-case basis. If I'm concerned of a milk protein allergy, we remove dairy or soy from the mom's diet or switch to a hydrolyzed formula. Now, if a child is very bothered by the reflux, has poor weight gain, back arching, they've tried lifestyle modifications, or maybe they're going to start but the child is uncomfortable, I do discuss medications along with the other interventions to have a cohesive approach. Because acid hurts, and sometimes anti-acid meds can really help these babies along with any of these other modifications. For all of these, close follow-up is key, which means I often have my reflux babies coming in every 2 to 4 weeks if symptoms are not improving, and closer monitoring for babies with slower weight gain due to reflux. I personally recommend seeing a pediatric GI doctor if 1, your general pediatrician is unable to manage GERD in the way that you'd like, 2, your pediatrician recommended an evaluation due to failed medication therapy or interventions, and 3, you want to see a pediatric GI about this issue. I've mentioned tongue ties already, but having a tongue tie can increase a baby's risk for reflux. Not always, but sometimes a tongue tie can result in a poor seal at the breast or bottle, resulting in more swallowed air, which can worsen reflux. One small study looked at 175 breastfeeding mothers with infants with reflux concerns related to a tongue or lip tie. They all underwent surgical correction of their tongue tie or lip tie, which is a frenulectomy, and filled out surveys of the significance of their symptoms 1 month after surgical correction and 6 months after. The study showed significant improvement in breast comfort, feedings, and reflux symptoms after frenulectomy. Another study looked at 1,000 infants, all with reflux and tongue tie concerns, that had already been started on medication for the severity of their reflux. They also all underwent frenectomies. Surveys of symptom severity were completed 1 and 2 weeks after the procedure, and over 50% of infants had an improvement of symptoms of reflux within the first week after the procedure, that they were able to wean off the reflux medications. Another 19% of infants had improvement in reflux symptoms, but still required medication, and 28% had no change in their symptoms post-procedure. So remember, tongue tie releasing may not be a definitive fix for reflux, but it's an option if all other etiologies and management have been evaluated and done. There is a large movement, especially on social media, to advocate for chiropractic care for reflux. I will be having a chiropractor turned DO medical student on the PedsDocTalk Podcast later this year. But overall, there is no good data supporting chiro treatments for relieving reflux. So it's all anecdotal, which means that people just feel like it may help. Some infants can respond well to massage of the abdomen and near the lower esophageal sphincter. But again, this is from clinical observation. More important is to discuss how feeding is going, any potential concern for a milk protein allergy, and assessing for tongue ties. Whatever you do, don't fall into the trap that it's absolutely curative to see a chiro for these issues, because we don't have that data and we don't have the clinical experience across the board to support that. And do not let any chiropractor manipulate or crack your baby's neck, as there is no data to support that this helps GERD, and it can be risky. So choosing to see a chiro is up to you and your child's clinician, looking at the entire picture and the cause or reason of the reflux. As an osteopathic physician, I do believe in craniosacral therapy, especially if we are feeling the child is tense in feeding or in their posture, as this can potentially increase the risk of GERD. CST, or craniosacral therapy, involves gentle mobilization of bony structures to release fascia, and since everything is connected in our body, it can impact feeding mechanisms as well. So do all babies need this for spit-up? Absolutely not. But if the baby is tense, it may help. We don't have much clinical data on CST as well as chirotherapies, but this is more of a clinical anecdotal option that I do support. It just should be by a licensed provider in your area who works with infants and babies on a regular basis. To be quite honest, I much prefer craniosacral therapy over chiropractor care for reflux if you're going to choose one. But remember, speak about your options with your child's pediatrician or clinician so it can be a cohesive approach. Because sometimes it may mean craniosacral therapy, you're seeing a chiropractor, but it may also mean formula, diet change, and medications, because we need to provide the best option for your baby and for their comfort. Listen, a final message. GERD is one of the hardest diagnoses I see for new parents. I call it a joy stealer for parents postpartum. It can be devastating and heartbreaking to see your baby uncomfortable with GERD. Remember that it may take some time to see results even if we implement interventions. And even with interventions in place, time heals. But that does not mean that there's nothing we can do to help mitigate symptoms. So advocate for yourself and speak to your child's clinician if your child is uncomfortable or you're concerned about their reflux. Does your baby spit up? Did your baby have GERD, and did any interventions you tried help? I would love to hear about your experience, because not only can I learn more, but this can help the community. Leave comments or questions below. And if you found this information helpful, please like and share this video, and make sure to subscribe to my channel to be the first to know about any new videos published. See you next time, and stay well.